Hi everyone who's joining us now. We're just going to wait a few minutes to allow people to join the event, so we'll get started in a couple of minutes. Hi to everyone who's joining us. Just to let you know, we still seem to have quite a few people joining, so I'm just going to give them one more minute to log on and then we'll get going with the conversation. Thanks a lot for joining us. Okay, I think we can get going. So thanks a lot to all of you for joining us, and welcome to this digital discussion about building back better for women and girls after the pandemic. I'm Jessica Abrahams. I'm DevX's Deputy News Editor. I'm based in the UK, and a warm welcome to all of you who are joining us from all around the world. This is the final instalment of a series of events that DevX has been hosting in partnership with Facebook, looking at how we can use data to better support women and girls during this crisis. Hopefully, some of you have joined us for those conversations. During the course of them, we've learned about key pressure points that are impacting women and girls during the pandemic, including the rise of gender-based violence, the reduced capacity to earn a living, the limited access to sexual and reproductive health services, and the impact on girls' education, and the increased risks faced by women who make up 70% of the global health workers on the front line of this fight, but are so often locked out of policy-making decisions. So in today's event, the last event in the series, we'll take stock of some of those conversations and the insights we've gained from them. But we also want to look forward and hopefully end on a bit more of an optimistic note. So if the pandemic has highlighted existing inequalities that women face, we want to think about how can we use data to ensure the well-being of women and girls after the pandemic, and how we can actually use this moment as an opportunity to build back better. So I'm excited to be joined by a really brilliant panel of experts to talk through some of those issues. Hopefully we can get them on screen in a moment. I'm joined by Laura McGorman, who is Policy Lead of Data for Good with Facebook, Juan Oviedo, who is Director of the National Administrative Department of Statistics of Colombia, Eileen Mokaya, Senior Country Director for Kenya and Uganda with Pathfinder, and Agnieszka Rava, Managing Director of Data Collaboratives for Local Impact with the Millennium Challenge Corporation. So a lot of expertise in the room today. We're really excited to have you all joining us for this event. I'm just going to run through a little bit of housekeeping before we get started. First of all, I'm really excited to be joined by our brilliant live illustrator, Chris Shipton, who is going to be illustrating today's conversation. So you'll see him doodling away on the screen there. And we'll send you all a copy of that illustration afterwards. It's a really exciting thing to have for today's conversation. The event's going to last about an hour. It will include a Q&A at the end. So if you have any questions for any of our panelists, do make sure to submit them via the Q&A box that you should see at the bottom of your screen. We welcome as many questions as you'd like to ask. You can also follow the conversation online using the hashtags GenderData and DevExEvent. And if you miss anything, don't worry, because we'll be sending you a recording of the event as well as a copy of Chris's illustration afterwards. So without further ado, we've got a lot to get through. So let's get started. I'd like to come over to you, Agnieszka, to begin with. Could you tell us a little bit about this concept of building back better? What does it really mean, and why does the pandemic provide an opportunity for it?
Thank you, Jessica, and hello to everyone. Thank you for joining us online. You know, pre-COVID, 2 out of 3 girls in many countries in sub-Saharan Africa would drop out of school before they complete their secondary education. And so these girls have been more likely to remain poor. They have been more likely to experience gender-based violence. And they also are 10 to 15 times more likely to contract HIV and AIDS than boys the same age. I think the pandemic has only exacerbated this situation. And so the concept of building back better is really about not returning to that baseline, but truly moving towards something significantly better. And I would also argue in different ways, because if one thing has been highlighted to me through this pandemic is that the manner through which we have led a number of programs does not build sufficiently reliable and resilient local systems and local capacity in a way where it doesn't require as much direct support. And so, you know, at MCC's DNA involves data. Data is part of everything we do. We use data to select our partner countries, to design programs that are worth the investment, and also to evaluate how we're doing. So we share that information, both the things that work and don't work so well. And so I am also, as a development practitioner, is really excited that we live at a time when data is abundant. We're surrounded with data from public sources, also innovative data sources that are coming in from the private sector. To me, that really presents an opportunity to help transform development, as well as how we do development, and improve the well-being of women and girls everywhere. Another important priority for MCC is to empower women economically. And so the challenge that I see in reaching this new normal is that when we talk about data, we often talk about ourselves and us using data. But what we really need to do is ensure that those skills exist in our partner countries. You know, and this is not just simple, this includes simple numeracy skills, but also visualizing data to be able to make decisions, as well as some of those more sophisticated data science skills like machine learning and artificial intelligence. There is a 70% gender gap in artificial intelligence. That is huge. And so at MCC, we have started doing something about that. For the last 5 years, I've been leading a program called the Data Collaboratives for Local Impact. The goal of that program is, in fact, to empower youth and young women in our partner countries and countries where another US government agency also works, the President's Emergency Plan for AIDS Relief, to empower them with those kind of skills so that they themselves can make a difference. Through that program, We have trained more than 2,500 youths, 60% of whom have been women. We have increased the amount of data that is being used by more than 3,000 organizations, and engaged innovators, local talent, local business owners and entrepreneurs in those countries so that they could make a difference. So Jessica, really, I think building back better means a future where women and girls are aware of the statistics around school dropout rates, and their parents are also aware of the consequences. It means that there is capacity to support public-private partnerships where sophisticated data sets are combined with more traditional data sources. It also means that within national statistics offices, there are women on staff who can contribute to sophisticated analytics that would help them navigate crises like the ones that we are living through right now.
Thanks so much for that introduction, and also for explaining the role of data in all of this as well. To get to a kind of more concrete idea of this, I'd like to come over to you, Eileen. You're in Kenya right now, I believe. I'd love to hear a little bit more about how this concept of building back better has played out after previous emergencies. And is this just something that the development community talks about but doesn't really happen? Or how have we seen this play out in the past?
Thank you, Jessica, and thank you, Rawa, and thank all the participants who've gotten the time to join this very critical discussion this afternoon or this morning, depending on your time zone. Indeed, looking at the previous emergencies or pandemics, data clearly demonstrates that women and girls are the ones that are most affected. But the critical question here is that, yes, we have data, and looking at our programs, what is it that we are not doing right? Because emergencies after emergencies, we still have women and girls still bearing the largest effect. So as Pathfinder, one of the things that we do across all the countries that we implement our programs is to put the women and young girls first in all the programs and ensure that all the interventions that we do implement are evidence-based. But having said that, it calls for a collective responsibility for both the civil society, our governments, and the private sector, because we all have a critical role indeed to implement a transformative agenda and build our communities to be more resilient. And I think for me, as we watch the pandemic and see how our young girls and women are being affected, whether it is rape, whether it is not being able to have access to essential services, family planning, we're talking about maternal deaths, we are seeing more skilled birth deliveries at home. We are seeing all governments in the interest of keeping our girls safe, keeping them out of school. But I'm sure you've all seen that the number of teenage pregnancies have actually gone up. So what is it that we intend to do and ensure that in future, we are more prepared in terms of addressing some of these effects or reducing the vulnerabilities that our young girls and women are facing? How do we innovatively and in a more meaningful way then begin to engage the communities to be more resilient by engaging them to come up with homegrown solutions? Because when you look at some of the programs that we implement, they are sometimes more donor-driven agenda. And so you have that transactional relationship in terms of how we implement our programs without sometimes saying, we've been implementing these programs year in, year out. Can we take a moment and pause and say, what is it that we need to do differently? Because data is telling us that we are not achieving or moving faster as we would have intended to do so. So I think it will be very critical that going forward, we accept that women and girls definitely are more vulnerable. But I think it's also important for me to point out that we have to look at these cohorts differently. Because when you look at the design of our programs, sometimes we tend to lump women and girls together. And we know that the needs and the vulnerabilities for girls are different versus women. So how do we make sure that even as we design future programs, they are really more responsive and speak to the unique peculiarities of the needs of these girls and women? I think I'll pause there, but as we continue to advance the discussions this afternoon or this morning, I think it's very important to say that we'll need to look at how do our governments and the organizations that we work for have more commitment, and commitment not just in terms of resources, but capacity, and to be able to have, or rather develop or co-create programs that are genuinely owned by the communities in which we work in. So we really need to do our business differently.
Thanks so much. And you've raised a lot of issues there that we're going to come back to a little bit later in the conversation, including the issue of breaking down the differing needs of women and girls, and of course, within those groups, breaking down the differing needs as well. Very often, the gender discrimination that women and girls face intersects with other forms of inequality, whether that's disability or sexuality and so on. Juan, I'm going to come over to you at this point, because I know in Colombia you've been doing a lot of work on the collection of intersectional data sets. So I'd love to hear a little bit about the work you've been doing on that during the pandemic and how you're hoping to use that data going forward.
Thank you, Jessica, for the opportunity of sharing our Colombian experience. The first topic that I would like to highlight is that this issue of having a gender mainstreaming in a statistical production is not something that comes to the surface just in the pandemic situation, but in Colombia, we have the opportunity ourselves to have designed a very important institutional and legal framework exactly 10 years ago, under which the Congress decided that Colombia was mandated to perform every 3 years a time use survey, which is currently the most important tool in order to face the double gaps that women face, not only in the labor market, but also in the unpaid domestic work, which is something that puts a huge burden in women in the current situation of COVID-19. And thanks to the institutional framework, we also have a historical opportunity that, as you may know, Colombia a few years ago decided to stop its internal conflict and to define a new social contract under which, in the current circumstances, the main topics and the main problems of the society were not violence or rural violence or corruption in rural areas or in general politics, but the new topic that came to the surface as a most important problem in our society was gender-biased violence. So we started to see that after being in war, let's say 50 years, we started to understand that we were violent against women and that we were going to define a new strategic tool in order to solve this situation. And that's why we believe that the role of a statistical production and as a tool of gender mainstreaming is a very important platform in order to develop dialogues, in order to bridge gaps, and in order to see how are we going to illustrate the political discussions that are going to solve and to propose, as Eileen was mentioning, to propose strategies or specific actions that are going to help women and girls during this situation. Currently in Colombia, we have a very rigorous framework of gender mainstreaming in statistical production. And the main issues that we are facing and that we are making visible in the current situation of COVID-19 is that in average in Colombia, for example, a woman works for, let's say, 14 hours per day. These 14 hours per day are divided in 7 hours in the labor market, in the paid labor market, and 7 hours in the domestic unpaid work. And the average man in Colombia works just 12 hours. And these 12 hours are not equally divided as women, 7 and 7 in the labor market and the unpaid domestic work. But for men, for the average man, he works 9 hours in the labor market and just 3 hours in the unpaid domestic job. So this implies that women are working 4 hours more per day than men as regards as on domestic unpaid work. And this puts an important constraint in the labor participation of women in Colombia, that, as you may know, in Colombia, we have a majority of women. So let's say 51% of the population following the most recent population census are women. But when we go to the labor force, the participation of women in the labor force has a huge gap of 20 percentage points against women compared to men. And additionally, when we go to see which are the gaps that we see with unemployment rates and the type of works that are performed by women, we see currently that 2/3 of women which are part of the labor force are working, first of all, in wholesale and retail, in services and entertainment, and in the hospitality sector, let's say hotels, restaurants, which are the most affected jobs due to the pandemic of COVID-19. 2/3 of women. And in those activities, we only have a concentration on 1/3 of men, which are part of the labor force. So what we are seeing here is that in the COVID-19, we are making visible a double gap that women are facing, not only in the labor market, under which it's traditional that labor participation of women is lower than men, and at the same time, there is a pay gap, a salary gap against women. Let's say in Colombia, it's around 10, 12%. For the same job, women earns 12% less than men in performing such tasks. But at the same time, we are seeing that there is an enormous inequality in the domestic unpaid work, which happens at home. And this puts something which is very important, and is education as a role in order to solving this kind of inequalities. For example, we have very strong sexist perceptions in our Colombian society. And for example, when in the most recent time use surveys, when we asked the society, both women and men, if they consider how was their perception about the sentence, women are more effective than men in performing domestic jobs. And 67% of both men and women were positive about the sentence. So this implies that this situation that we are facing in a very real way in the COVID-19 pandemic situation is something that roots at the educational system, and that we need to allow the information and the gaps that we are making visible due to statistical production and gender mainstreaming of this statistical production in order to change the social norms of our country, and at the same time to allow the educational system to provide the seeds in order to change in the longer future the main perceptions that we are facing of the role of women and men in our society. So that's why I wanted to close this short participation saying that the role of statistics and the role of information is strategic right now, because we need to set interdisciplinary dialogues in order to allow public policy, but also private strategies, the educational system, and at the same time, the labor participants or the participants of the labor force to be conscious and to be accountable that it's important to contribute, all of us, in order to solve these gaps that women and girls are facing in our societies. Thank you.
Thanks a lot for that, Juan. It's really fascinating to hear about the work that you're doing. And that's, of course, the government perspective on collecting data. I'm really interested to come over to you now, Laura, at Facebook, to talk a little bit about what the role of private sector organizations might be here in contributing data to this effort.
Thanks so much, Jessica, and thanks, Juan, for the really thoughtful setup. At Facebook, we take a number of approaches to share data in the context of not only the COVID-19 pandemic, but I manage a program called Data for Good, and we leverage a range of data sets, both on sort of the mapping side of things that leverages location data to try to better understand things like, are people adhering to stay-at-home orders around the world? And in the context of natural disasters, are we seeing people evacuate when a hurricane is due to make landfall? And what we found in some of the mapping work, and this is pretty interesting, novel findings, is that there are differences in mobility during things like hurricanes and typhoons, that women and men do have different evacuation rates, and can be displaced for longer periods of time. You can imagine a scenario in which a mom has to leave a place that's been devastated by a natural disaster with a family, but then typically a man may reside and stay, trying to sort of regain economic stability for the family and remaining closer to home, or sometimes the reverse can be true. And so we do see disparities in trends in mobility that are different across men and women. And then most profoundly, which I think has been echoed by the speakers thus far, we have very clear data from surveys that we run about the differences in economic resilience in response to something like the COVID-19 pandemic. So we actually just released new data from a global survey called The Future of Business. This is a partnership with the World Bank and the OECD that we've been running for the past nearly 4 years now. And what we decided to do in the aftermath of the COVID-19 pandemic is to make it much more timely. So we're doing this survey every month now in 50 countries around the world. And similar to what the other speakers have said, there's data that's specific to the challenges we face right now, but then there's a whole lot of data that's more indicative of systemic inequalities. And so we found, for example, that female-owned small businesses around the world were more likely to have closed during COVID-19. And some of that had to do with things that we already know to be true about women-owned small business. So longstanding research and collaboration with the World Bank shows that women-owned small businesses tend to be smaller. And a pretty staggering percentage, about a third of women-owned small businesses on the Facebook platform that we surveyed are single-owner businesses, meaning that the owner of the business is the sole employee of their venture. So you can imagine in a world in which we're all having to sort of, if we have kids, be teachers and caregivers all day long, if you're the only employee of your business, the likelihood of you being able to stay home when you have to take care of kids is pretty low. And we find that women, of course, are twice as likely to be spending 6+ hours a day right now on domestic responsibilities. And again, these are women small business owners that we're surveying. So even if you have a business to run, many women are still doing without childcare, and you can imagine the impact that would have on your ability to stay open and sort of run either it's a brick and mortar store or an online business or both. And we also see that women-owned small businesses are more concentrated in the industries that have been hit the hardest. So it's very well documented in the literature that women are more likely to be running businesses in sort of a professional services industry, sort of things like restaurants and cooking. We also see women doing a ton of work in sort of hospitality and event-based businesses. Well, with national travel bans in place or with actual bans on things like restaurants being open, women-owned small businesses were significantly more likely to have been closed during the time of the survey. So I think when we think about building back better, I think that there's an element of targeting financial assistance to women-owned small businesses. Again, well documented in the literature that that's not only benefit for the businesses themselves, but has sort of trickle-down effects on communities when you focus financial assistance towards women and women-owned small business. I also think that there's a longer-term set of research that I know the World Bank is very interested in, and I think would be a good thing for the world to focus on is, how do you incentivize female entrepreneurs to enter into sectors for which resilience is high, for which demand is high. Some of the research that we've done on women operating in male-dominated sectors is very often their profits can be orders of magnitude higher, and that's really the only difference sometimes that it takes is women can be running a business, and it's not about lower access to education, it's not about lower entrepreneurial spirit. If women just pick the right industries, very often that can be enough to close the gender-based wage gap. And so I think there's a lot of work in terms of building back better to think about the industries of focus, and then targeting financial assistance to the women-owned small businesses that need it the most.
And how can organisations and governments who are working on these issues use the data that you're talking about here? Is it publicly available, and can it be broken down to the local level as well?
Great question. Yeah. So we have a publicly available data instance on Humanitarian Data Exchange. Most of you are probably familiar with HDX. It's a data sharing platform run by UN OCHA. And it's sort of the go-to place for humanitarian data. And so Facebook has an organization page on HDX. All you have to do is search for Facebook. And then we do have our country level aggregate data from the Future of Business available for public use. The micro data, so if you want sort of de-identified response level data, that would be more for writing a statistical analysis. That's accessible through a license agreement. And you can email futureofbusinesssurvey@fb.com. But we do see the majority of users benefit from the country level aggregates because typically what people want to find out are sort of higher level findings. And that's completely publicly available, and we welcome its use by any and all.
Thanks so much for that. And I'd just like to remind our listeners at this point that if you do have any questions for the panelists, you can drop them into the Q&A box at the bottom of the screen. But building on this issue of localization that we've kind of been circling around, obviously building back better is going to look different in different contexts. Agnieszka, can you tell us a little bit about how we can be sensitive to that and how we can localize this concept?
Yes, thank you. And so exciting, Laura, to hear about these new data sets that are available. But to localize, and even in this program that I've led for the past 5 years, I borrowed and built heavily on another very important operating principle at MCC, one that we call country ownership, which really means empowering counterparts in those countries to be partners in the solutions that are developed. But I think that localizing this needs to involve even greater amounts of local empowerment. And so a bit of what Eileen was getting at we need to put women at the center of these issues and empower them to use this data that we're talking about themselves, so that they can be contributors at every level. You know, I think ultimately our partner countries' data ecosystems will be strengthened and will have better solutions tailored to the well-being of girls and women if there are women that are collecting data, that are analyzing the data, and making decisions based on that information. So I know that's not easy and that it takes time. But let me tell you a little bit about how we've been doing this. So through our work, we partnered with local organizations like the Tanzania Data Lab, or in Cote d'Ivoire, like Segen, a local data analytics firm. And we've provided them with resources as well as assistance so that they could be the ones reaching out to these different categories of women and stakeholders. So high school girls, small women-owned businesses, aspiring data scientists, and provide them with a place where they could come to, a safe place, which there are not many, as you know, in many places that we work in, and where they could be equipped with some of those skills, and also where they could have role models to follow. And another element that has been extremely successful with a program that we stood up with partners Des Chiffres et des Jeunes in Côte d'Ivoire, we have been running a data fellowship. So 5,000 individuals, youths from all over Côte d'Ivoire, applied for 100 spots. So you can see there's a demand for these skill sets that are highly employable afterwards. About 100 of them were selected. And even though in Côte d'Ivoire, women only represent about 10% of the STEM fields, we were able to select over 30% of women who were trained in different types of data skills, and then placed within NGOs, within ministries, and also even within health centers, where this pandemic is playing itself out. One of the women, and there are many such examples, but we don't have time to go over that. One of these women, Flore Kofi, was able to develop a visualization for the health center that is being scaled up now, because it shows where there are gaps in HIV and AIDS testing, for example, or in some of the measures that are being taken also to track patients that are being lost to follow-up. So, you know, all of these fellows we have found are now highly employable. 60% of them have found jobs. Some of them are continuing their education. And what was also really exciting is this last cohort was being deployed to some of their sites during the shutdown in Cote d'Ivoire, and just a couple months ago. And yet, all of them, unlike many of their counterparts across Africa, were able to remain productive. It was not an easy process, but they remain part of those of us right now who are connecting through this mechanism. So to me, localizing is really no longer about us using data. It's at different levels, from the community level to use simple information to different levels of ministries again, and us enabling that kind of engagement of women so they themselves can be looking at those data sets and making the right decisions.
So lots of really interesting examples in there. Thank you. And Eileen, you also mentioned the importance of looking at locally driven solutions. So I wondered if you had anything to add there.
Yes. When I mentioned about locally homegrown solutions, I was trying to draw this from the Pathfinder work that we've been doing in a number of our countries, not just Kenya alone, where we try to put our communities first and work with all the local leadership to be able to truly identify what are the really concerns and be able to design programs that are really responsive to the needs of the women and the girls that we serve. because emergencies or no emergencies, we are all very aware that women and girls are disadvantaged in many ways, even in terms of having access to essential services, be family planning, be maternal child health services, be HIV, because even if you look at HIV, who is really most affected? It's women and girls. They are more vulnerable for very many reasons. And if you look at the countries in which we work in and look at the socioeconomic status of these women, the level of education, we have got very high illiteracy levels. But that does not mean that we cannot implement a transformative agenda. And Pathfinder has implemented very successful programs, especially around adolescent sexual reproductive health, empowering women to be able to have access to these services. And the only issue here that we all have to look at in terms of how can we do things better is that despite the fact that we've had tremendous successes in all the countries that we work in, we need to take our programs to scale. Because when you have those pockets of successes where you're implementing them and you don't take them to national scale and coverage, you're not able to feel that impact. And that is why in most cases, people say, we've had a lot of organizations working in these countries. We've seen a lot of resources coming in, but are we really implementing those programs with the intensity and the scale that is required for us to be able to see that significant difference? Because we are making strides, all right. We really appreciate the milestones that we've made, but I think we need to ensure that we move towards coverage to be able to really demonstrate that. And that's why I said it's not just a question of us implementing programs, but also making sure that the communities themselves and the women and the girls that we brought to the center really continue to play that critical role for purposes of sustainability. And one of the things that Pathfinder has done, and we've made a very strategic move in that. We want to see how we begin to look at our programs where we are saying we need to have more programs that are women-led resilience, because we know that in initiatives that are women-led, you're more likely to see sustainability, because women, for some reason, they still stand and rise despite the many challenges that we face.
Thanks so much. Thanks so much, Brad. We've had loads of really fascinating insights, and one of the issues that I'd like to get to is not just about the data collection, but also, I mean, it's all well and good having this data, but how can we make sure that it's used by governments and that it's used well? I'm sure this is something that all of you can speak to. But Eileen, I'm going to stay with you for a minute if you have anything to add on that, and the other panelists, if you'd like to raise your hand if you've got something to add.
A very interesting question, that how do we make sure that governments and organizations like ourselves and the private sector really do commit ourselves. I know with all the available data that is there, all governments actually know where the gaps are. I think where we have a shortfall is when it comes to issues of putting in the right investments. We know where the gaps are, we know where the issues are, but are we really committed to putting those investments, building the necessary capacity and infrastructure to be able to deliver for women and girls? And also, how do we ensure, and I think this is something that is very critical, I don't have an answer, but we need to look at what kind of frameworks can we put in place to be able to hold our governments accountable? Because an accountability framework is very key in terms of making sure that the adequate resources translate to actions that actually influence or transform the lives of the women and the girls. How do we begin to have voices from the communities in which we work when you talk about social accountability? Where is the social accountability for women and girls? Because it's not that we don't have the information. We know where these gaps are. We know where the challenges are. Our governments know that. And they have committed themselves on paper, but we need to move just from signing these statements that we are gonna change the way we do business, but really begin to see actions that really translate to transforming the lives of the women that we work with. And I think for the civil society sector, we have a critical role, not just as an implementer in terms of changing the lives of the women and girls, but also by holding our governments accountable, really playing that watchdog role in terms of being the voice of the voiceless, especially when they cannot be able to speak for themselves. And there's also opportunity that is largely untapped, and that is the role of the private sector. Where does the private sector piece fall in? Because for a very long time, it's been the civil society sector and the government, and we feel there's great opportunity for us to tap in to the private sector to be able to truly serve the women and the girls.
And Laura, on that note, would you like to jump in there and
yeah.
add anything?
Yeah, thanks so much. I was thinking about, this is something I care deeply about because I think the Data for Good space has had a lot of movement forward in the last 10 years. And as a result, we've moved from a place where there was a lot of meetings around idea generation and lots of data sharing partnerships that sort of would reach the proof of concept phase, but then really falter when it got to scale. And something that I firmly believe is that as data providers, we need to think like good product managers. And they say good products solve not only headaches, but migraines for their users. And so what I've seen on the Facebook side is that the key to adoption and use has to do with the fact that you have to solve a migraine for people working in the field. A major example of this has been Facebook making network coverage data available, meaning is the internet up or down in the aftermath of something like a tsunami or a hurricane. And the reason we saw people using that data was because there was no other data for network coverage available. And so we were solving a really big gap, not just a fine-grained one. I think we've seen that as well with our high-resolution population density maps. If you make the world's most accurate population density data available, which is the backbone of really any social investment you might want to make, you're solving a big problem. You're solving a migraine for people. So I think as sort of data providers, we need to be focused on not only what the gaps are, but what are the gaps that are really thorny in people's sides? And when you make data sets, how do you really solve a problem for people? Because what I've seen, I've been working in the data for social impact space for a while now, is that we sort of stop with a little bit of market research. You talk to one or two people, oh, that idea is interesting, and then people go off and build a data set that may or may not have only been useful to the one or two people you spoke to. And so I think it behooves us to get a wide range of perspectives before we start the build process, and hopefully we solve migraines rather than just headaches by doing so.
Agnieszka, do you want to jump in there?
And so I agree with Eileen that governments need to be made accountable, and with Laura that there are these data sets. But I think at the end of the day, we have to look at this as a functional system where there are the data producers and, of course, the data ethics and governance structures that protect citizens, but then also where citizens at all levels know to ask for data, because data, it becomes powerful, a powerful way to be able to go to the local school and talk about the budget that was supposed to be there and what may or may not have happened with it. So I really feel that a key constraint, and if you look across the countries where we work in, there is actually an abundance of data. There's only 1% of that data that is being used. Some of it is, of course, siloed, but again, if you go into ministries, some of the staff don't know what data they can share, how to process it so it can be shared, or even how to manipulate it and combine it with data from other sources so it could be more insightful. And I would argue that is true even at the hyper-local level, because what we've seen is where we have gone and trained communities to use OpenStreetMaps to map their own resources, and they finally saw that the health centers were so far that women and girls had no hope of getting there, given the amount of time that they had available in the day. That made the communities themselves think about the possibilities of different solutions. So I'd go back to what I feel is a key constraint, and that is empowering through information and data, and the girls and women about whom, for whom we are trying to design those solutions.
Juan, I know you want to jump in there. We've just got a couple of minutes left and I want to make sure we get to the audience questions. So I'm going to actually come to you with one of them. So maybe if you want to make a couple of points on this, that would be great. But we also have a listener who asks, COVID-19 presents various challenges for data collection, such as physical distancing and lack of access to internet and so on. In this situation, how can we ensure access to robust current data for informing evidence-based policy decisions, particularly in rural and underserved areas?
Okay, yeah, this goes closely with what I wanted to say, and it's that I think that the COVID-19 pandemic situation has played a tremendous role in making the gaps visible. We know where the gaps are, but we have to find where do they come from. And I do believe that the Colombian experience has shown that the roots of the gaps that we are facing currently start at the way we distribute the unpaid domestic work at home. And I do believe that public policy and the private sector have a huge task to play there in order to provide public goods, in order to provide incentives that allow the equal distribution of time of unpaid domestic job, because this is going to be fundamental at solving the productivity gaps that we face in our society. And at the same time, this is going to allow women in the girls and women in their development to be able to choose which are the main areas of study that they want to perform at, and which are the types of jobs that they want to perform in society. If they see that there is an equal distribution of the responsibilities at home, thanks to the fact that there are effective both private and public strategies in order to provide a care system and adequate public transportation system that solves some of the gaps that are gender-based. And I believe that the responsibility of information currently is how, if we know where the gaps are and we know where do they come from, is how are we going to make the strategies or the policies that are going to be developed effective, and to provide evidence that those strategies are going to be effective in solving the gaps that we are trying to address in these kind of situations. That's something that I wanted to insist on, and I believe that as Eileen and Jens were saying, I'm sorry, we already have the information, but we need the information to illustrate effective strategies that could solve the gaps that we are facing currently. Thank you.
Thanks for that. And another question that's come in that might be related is, how can we ensure that not only national data collected by governments, but also local data gathered by gender advocates and women's and girls groups is used to inform programs and policies? Do you have any thoughts on that?
I'm sorry, could you please restate the question?
Sure, okay. It's how can we ensure that local data gathered by local gender advocates or women's and girls groups are also used to inform programs and policies?
Okay, I think that the role of National Statistics Office should also allow the role of data stewardship, and is how are we going to disseminate the information in order to allow a massive access of the information. Is how we present information plays an important role, because we need to allow all members of the society to be empowered by the information that we produce. And this puts a very important responsibility in the way we strategically disseminate or communicate the information that we are grasping from the social surveys and from the economic surveys that we perform in our society. That's why currently in Colombia, we are strengthening our capabilities of grasping perceptions, because we believe that as we grasp perceptions from society and we allow how to measure how people are feeling or how are expecting their lives to perform in the future, this gets us closer to the main feelings or sentiments of society. And that's why we currently are strengthening these capabilities, and we are developing a social pulse, which is a perception-based survey that is going to allow us to show how, for example, women and girls are feeling overburdened of domestic work in the current situation of the COVID-19 pandemic. Thank you.
Thank you. And we've got loads of questions coming in about this localization issue, so hopefully we'll have time for a couple more. There's a question here for you, Agnieszka, about how can we promote the use of data among women and girls in the face of high illiteracy rate among these groups in some places?
No, I think that's it's a wonderful question, and part of this, of course, goes back to foundational education. But I do think that even what we're seeing is even in primary and secondary schools in a lot of the partner countries where we are working, women are significantly disadvantaged and not encouraged to pursue basic numeracy and data literacy. And so it needs to start with that, but you can't wait for that to be different in order to begin. And so how do you do it? You start somewhere. And so in Tanzania and Cote d'Ivoire, as I mentioned, our partners have gone into high schools and created, data science clubs. But at community levels, I know data can sound scary, but data can take many forms. And so I find it exciting, Jessica, that you have a visualizer here. But one of the ways that we have found truly effective in the hyperlocal level is even to use art and murals and even printed cloths, kangas in Africa, to communicate information and data and make it more present at that level. So there are ways out there, and I feel like it just needs to be a higher priority.
Thanks so much. I think we might have time for one more very quick question, which is sort of similar to what Juan was talking about just now. The question is, how we ran a campaign to gather recommendations from girls on sexual and reproductive rights. And the recommendations were well received at the state level, but the translation of voices and ground data was lost at the central or national level. So how can government accountability be managed at scale? I wonder if Eileen or Agnieszka, you have any points to add to that?
One of the ways that because holding a government accountable is not a very easy task, that I can tell you for a fact. They would show that commitment, but I said it does not translate into actual action. But one of the things one of the strategies that we've deployed, and which we've seen some positive results, is in terms of how do you identify champions within government who believe in the agenda for women and girls? Because when you don't have champions who believe in the women and girls agenda, it becomes very difficult to push through some of these excellent ideas. And so in terms of having champions within the government, and very critical high-level positions. It's not just anybody, it's having to have influencers on your side. That has shown us some results. The other way you can hold government accountable sometimes is how do you use the local structures, the government local structures at the local level to be your voice at the national level? Because you really must have that as a collective voice that is being driven, not just from the civil society organizations, because then it gets to be translated as your agenda and not the community's agenda. And in most cases, when it is misconstrued and arrives at the level of the national level with a lot of mistrust, then trust me, it will not see the light of the day. So the message is also as good as who the messenger is, and in terms of how you actually get to package. Of course, one caution is that you not see results immediately, but do not give up, because you need to keep on building the allies. Don't give up, but finally, you get a breakthrough. And the other strategy that has also worked for us is in terms of how you engage faith-based groups, because faith-based organizations sometimes seem to have some responsibility in a manner that is best understood compared to other civil society organizations. So how do you really bring in all the players together so that it's not a pathfinder agenda, especially when you want to take it to scale? It's not an organization agenda. It's really an agenda to transform the communities that we work in. And also that is where the advocacy role comes in very critical, especially when it comes to SRH issues.
Thanks so much for that. Unfortunately, we've run out of time, but I think it's great to end on that very positive note and the message of not giving up. It's been a really fascinating discussion, so thanks so much to all of our speakers for joining us. We're really, really grateful for your time. And thanks as well to all of you who have tuned in, not just for this session, but all of you who have been following this series. We will be sharing a recording of this event with you by email. You can also catch up on all of the events in this series on our website. We really hope they've been useful for you, and if you have ideas for other issues that we can cover around this theme, we'd love to hear it, because we're going to be continuing this conversation as a content series. So do keep an eye out for more stories to come. We'd also like to invite you all to join our Twitter conversation about how data can support women and girls during the pandemic and other health emergencies as well. That's next July 29th at 8 a.m. ET, and you can join that by following the hashtag #GenderData and by retweeting our questions and adding your own responses. So once again, thanks so much to all of you for joining us, and to all of our panelists, and to Chris, our brilliant illustrator today. You'll be getting a copy of that illustration shortly. And I know we've had some questions about the resources and the data sets that our panelists have been talking about today. So we will include links to those in the email as well. Until our Twitter conversation next week, and I hope some of you can join us for that. Do keep safe. All the best from all of us on the panel today, and all the best from all of us at DevX as well. Thanks for joining.